Hello and welcome to The Ordinary Doctor. I am The Ordinary Doctor with the extraordinary, the talented, the amazing Dr. Neha Gurnani. Neha, welcome to the show. Tell us a little about yourself, please.
Thank you so much, Manan. Thanks for the kind introduction. I'm Neha Gurnani. I've been practicing dentistry for about almost 10 years now. A few years in Dubai, and then we moved back. So since about 3 years, I've been practicing in Bombay. My clinic, I work with Dr. Udat Kher in Khar. It's great to be here. Great to discuss dentistry, my favorite.
So, thank you, Neha. So, what we'd like to focus on today is dentistry for children. Basically, could you tell us certain food groups that we in general for our children should avoid for their dental health and food groups which you feel will help them boost their dental health?
As parents, we're always in a hurry, always trying to find quick fixes for our kids, especially as snacks. It is a very natural thing to go to these packaged cereals even in the mornings, or often resort to giving our kids biscuits and chips. We feel, okay, theek hai, chips are not sweet, they are fine. But basically, anything that is sticky, that can stick to the grooves of the teeth, is definitely not good for your child's teeth. Yeah, fizzy drinks, anything that is acidic, your sodas, Pepsi, all these are very, very strict. No, no, high sugar content, very acidic, As much as we can prolong introducing them to these artificial sugars, ideally, as dentists, we would like to recommend that sugars should be introduced in a child's diet only at 3 years of age. And there are a lot of other alternatives that we can go in for. For example, if nuts, great in calories and they are not bad for your teeth. Makhana, things like corn, boiled corn. So things that are healthy, wholesome, they fill your stomach. At the same time, they don't stick to the teeth. No artificial sugars. Fruits are the best snack we can introduce. Raw vegetables like carrots, cucumbers, these are the things we kind of uh, suggest to parents to incorporate in their child's diet as much as possible.
I'm glad you spoke about the fizzy drink. So I think what I'll do is I'll call you back for our childhood obesity discussion video also, because I think that right from the beginning, if we can train them not to
Yeah,
have these fizzy drinks, it'll be useful. Uh,
absolutely, absolutely.
are there any supplements that you'd like me to give the children? Are there any meds which you'd like us to avoid in children for their dental health?
Uh, yeah, see, there are a few very well-known medications that can cause harm to the children's teeth. For example, the tetracycline group of
Hmm.
antibiotics. They
Hmm.
are known to cause staining, pitting, and that yellowish tinge in the teeth. Even pregnant women, in fact, are advised not to take any tetracycline antibiotics. It could cause some kind of damage to the tooth buds. Um, Apart from that, children who are asthmatic and are on like prolonged medication for asthma, those kind of medications are even acidic. So your doctor will definitely warn you that be extra cautious with your child's dental hygiene. Also, some parents are not aware, but like I see a lot of children on homeopathic medication for like just immunity and cough and cold. These are prolonged, they are taking them for a long period of time, and all of these have sugar in them, even the syrups that we give their children. So, if your child is on any kind of medication for a long period of time, definitely it is going to cause harm to the teeth. And but it can be taken care of by just compensating with better oral hygiene. That's where
Hmm.
the parent
Hmm.
comes in and has to take extra precaution.
So, what about calcium and vitamin D? Is it worth giving children those supplements so that they might get better teeth?
No, not necessarily. I'm not someone who suggests something like to be carried on lifelong.
All right. Now, the very, very tricky part, how to improve the brushing technique amongst the kids. Because brushing from childhood is equal to eating toothpaste. or taking that thing and going horizontal, ramadab, ramadab, which every dentist just raises their eyes. You've raised your eyes at me quite a few times that don't indicate brushing like this. Brushing is indicated like this. So any
Yeah.
tips on techniques in which we can help children improve their brushing, and we brush their teeth a little better.
Yes, firstly, I would like to talk about the toothpaste bit. We do not recommend a toothpaste which has fluoride in it until the child is about 2 years of age. Because,
Okay.
as you said, they most of the time just ingest that toothpaste. They're not really using it to brush, and it could cause fluorosis, etc. Unless it has been recommended by your pediatric dentist that yes, you need a fluoride toothpaste that young. But from the age of 2 onwards, we can use a fluoride toothpaste, preferably with 900 ppm. But the amount has to be monitored, obviously, by the parents. And what we recommend is like a pea-sized amount, just a little bit size of a pea on the brush. And the toothpaste, I can just show you, it can be like smeared inside the bristles so that it gets
Okay.
released very slowly and it doesn't come at once in the mouth. Otherwise, the child obviously is going to just take it in. Um, when it comes to the toothbrushes, a lot of mothers early on are using these silicone brushes and finger brushes which are not very effective, especially to remove the plaque which sticks on the teeth. So we recommend like a baby brush until the child is about 2 years of age, a normal baby brush, and after two they can move on to something like this, very easily available. It's a junior brush for 5 plus, but children can use it even after two immediately. And parents have to brush the children's teeth themselves until they are at least 6 years of age. What we believe is that a child is not capable of brushing his or her teeth unless he can, tie his own shoelaces, because that's the kind of dexterity you need to be able to brush your teeth properly. Um, so yeah, parents themselves must supervise. Yes, if they want to do it on their own, don't. I mean, you must encourage them, but you have to repeat it yourself once, okay? And the ideal way for any child to brush their teeth is obviously, I'm going to show it to you on this toy model. But so there are these 6 sections, two front sections up and down, and the back sections on the four sides. So each quadrant, like we call them, have to be brushed on the front, at the back, front and back, and it can be circular or it can be vertical. It doesn't have to be aggressively horizontal. So that kind of damages the gums. The child should be standing in front of the parent, facing towards the basin. And you can rest the child's head on your chest or your stomach and brush the teeth. Um, training them to spit and gargle after brushing is extremely important so that they get used to the idea that the toothpaste doesn't need to be swallowed.
Hmm.
And definitely tongue cleaning has to be incorporated. The parent can do it with a toothbrush itself after the child is about 2 years of age. But pre 2 years, they can even do it with a gauze, just massage the tongue and remove that biofilm on the tongue. Yeah, these are the techniques we recommend. Flossing again can be introduced with at about 5 years of age. It's an excellent habit, and I feel if they start young, they will definitely continue it. Also, nighttime, in fact, if I may say so, is more important than the morning brushing because
Okay.
you've eaten all through the day, your food is all stuck in the mouth. So if it's important to the parents, I'm sure that it
It'll-
passes on to the child. Like it's a non-negotiable thing to do in the night, before you sleep. Yeah, just if we can, as parents, follow these few things, it's not really that difficult, and the child gets habituated to it.
And that's such a fabulous answer, because I was sort of doing a mental checklist. Am I doing it right for myself apart from doing it right for my kid? So that was brilliant.
Yeah.
What is your opinion on oral iron? A lot of my kids, they require oral iron to be prescribed to them.
I mean, you can, the only thing is if you're giving it in a syrup form, make sure that your child is gargling well, or if you can dilute it a little bit, ask them to drink it with a straw. It doesn't come in contact with the teeth as much, you know.
Hmm. Hmm.
Otherwise, definitely not an issue. As long, like I said, certain cases, medications are unavoidable. It's just that if after taking the medication, if we can just rinse the mouth immediately or like do a quick brush, it will not affect the teeth as much. So,
Perfect. This is an opinion question. I know there are studies which show one way or the other, but I would love to know your opinion on this. The use of pacifiers amongst very small children, does it lead to more protuberant teeth or dentition problems when they grow up, or are you okay with parents using pacifiers within reason?
uh, I know there has been a lot of talk about this, and we get asked this a lot. My personal opinion and what I have followed with my child is strict no for the children.
All
Uh,
right.
Parents will hate me for this, but the thing is, it does in the long run. Not only pacifiers, but even those kids who are only bottle fed, they do develop their jaws in a very different way. The teeth start protruding because they are constant, their mouth is constantly doing that motion, you know, even when they don't require milk, they are constantly doing the suckling motion. Their tongue is pushing their teeth in front. The jaws are forming in a more prognatic way, you know. So I feel that in the long run, you may, I mean, at that time, it's a quick fix, but in the long run, you may be causing harm to your child.
All right. Thank you so much. It's been incredible having you and listening to you. And there are so
Thank you
many
so
more
much,
dental
Manan.
topics I'm going to bother you with. So thank you so much. Thank you.
Thanks, Manan. Thank you so much. Take care.